Morning, everybody. Thank you for joining me today. On Friday, we launched a new survey on Engage MB to ask Manitobans what activities and services matter most to them that will improve the quality of life once we're able to begin to safely ease the current public health restrictions as more and more Manitobans get fully vaccinated. Throughout this pandemic, we've endeavoured to reach out directly to Manitobans, get their input on a variety of measures designed to protect Manitobans from COVID-19 so we could better understand Manitobans' personal experiences with this virus and their views on the vaccine. So I encourage all Manitobans to fill out that survey and give us your feedback at engagemb.ca, please. Like all Manitobans, I'm pleased to see our COVID case numbers continuing to drop in the right direction, thanks to the efforts of Manitobans who are following the fundamentals, following those public health orders. We've done it before and we're doing it again. We need to continue in that direction because, of course, we know that our hospitals are facing incredible pressure, and thanks to our frontline staff in those hospitals, our nurses, our physicians, our ICU people, respiratory therapists, all the folks that work in our facilities are doing great work for us, and we thank you and we appreciate it. We're also getting the support of neighbours as well, and we thank them too. A little less so than was needed a week ago, but still we need that support through this hot period with COVID. So our duty isn't over yet. We need all Manitobans to continue to do two key things: follow the public health orders and get a vaccine as soon as possible. The sooner we do those two things, the sooner we can get COVID down, and the faster, therefore, we can begin to reopen our economy, the faster we can get back to doing some of the things we love, seeing some of the people we miss. Just last Thursday, our government shared the next phase of Manitoba's Protect MB vaccine efforts to ensure broad uptake across the province, and that's crucial for the sake and sustained reopening of our economy and our communities. And we know from clinical research, clinical leadership, that there are thousands of Manitobans who are open to getting a vaccine, but they need your support and encouragement to do it. And the best place to get that support and encouragement, of course, not from me, but from the people that you know and love close to you, in your neighborhoods and in your community groups and in your family circle. So I encourage you to do that. A little nudge, a little reward, help make the decision to roll up your sleeve and get fully vaccinated. That's a good thing for all of us. Manitobans have also told us that getting back to the things they love is one of the biggest incentives to getting vaccinated. And so today, I am very pleased to share with you the launch of a new secure immunization card that will be available to Manitobans 2 weeks after they've received both doses of a COVID-19 vaccine. In the interim, until all public health restrictions are lifted, Manitobans will get certain benefits with this card. This is the card, this is what it'll look like, and I'll explain how you can apply for it after your vaccine in a minute. So we hope this is a temporary measure. Of course, as we get to the point where everybody is vaccinated, we don't need to worry so much about this, but in the interim period, this is an important additional thing that'll benefit you. With this card, you will be permitted to travel within Canada without having to self-isolate upon your return to Manitoba. You will be exempt from the self-isolating requirements if you're deemed a close contact by public health. In other words, if you get a call from public health notifying you you've been in close contact with someone who's had COVID, because you have this card and because it's evidence that you've been vaccinated twice, you won't have to self-isolate as a result. And thirdly, with that card, you'll be able to visit family and friends in a personal care home or in a healthcare facility as well. That's good news for those we care about deeply who are in those hospitals and in those personal care facilities. Good news for you. As we move forward with our reopening plans and as more Manitobans get fully vaccinated, there may be more items or privileges available to those who have an immunization card based on the advice of public health. The process to order a new immunization card is quick, it is simple, and most importantly, it's secure. 2 weeks after you receive a second dose of the COVID-19 vaccine, you can apply for a physical and or a digital card using the new online portal. You simply go to the website, immunizationcard.manitoba.ca, and you apply there. The immunization cards contain no personal health information, no personal health data. That's important for you to understand. Rather, the card only shows your first and last names, and it shows a QR code. When scanned, that QR code will show that you're fully vaccinated. Once you've successfully completed the online request, you'll automatically receive access to your digital card. And there's also an option if you want a physical card like the one I waved around there before, that'll be mailed to your address. The address that's on your Manitoba Health card, of course. And you'll be expecting that in the mail within the 2-week period. Why does this immunization card matter? Because vaccines are the way out of this pandemic, that's why. And because vaccines are how we get our lives back in the short term and in the long term. Getting a vaccine is really important right now for many reasons, but I'll share 3 of them with you. First of all, to protect our healthcare system. So it has the capacity to care not just for COVID patients, but for everybody else. And that's a big concern to me, to our government, and I know to governments and premiers across the country as well. As this pandemic pileup continues to push back necessary treatments and surgical procedures for so many Canadians, it's a monumental challenge to get that fixed. And the sooner we can get at that task, the better for all of us. The sooner you're vaccinated, the sooner that healthcare system can start to recover. 2, for our small businesses, the business owners, the Manitobans that depend on those jobs that they provide, all of us that depend on their goods and services. This has been a real tough time. And, you know, these small businesses pay for the services like healthcare services that we enjoy. They pay for them with their profits, with their share of those profits. They pay their taxes, and they offer services, and they create jobs. And the sooner we can get vaccinated, the sooner we can help our friends and neighbors get their jobs back, get their lives back in those small business environments that are so important to all of us. And finally, for our freedoms. And the freedoms that we took for granted probably until a year and a half or so ago, we need those freedoms back. We can earn them back. You want to be able to go to a wedding. You want to be able to dine in a restaurant. You want to be able to go to the gym. You want to go back to school. You want to travel and explore. You want to go to church. These are things that we used to take for granted we had the right to do, and we want those rights and freedoms back. Sooner we're vaccinated, sooner we get our freedoms back. As a government, we're doing everything we can to bolster vaccine availability and accessibility. I want to say a special thank you to our vaccine team for helping Manitobans by equipping them with all the information and the supports they need to make the right decision to protect themselves, making it pretty easy for people to be able to get a vaccine. There are sites all over the province for you to use. We all want to get back to some sense of normal, and that path forward is to get all eligible Manitobans vaccinated as soon as possible. This Thursday, I'll be receiving my second dose. And I encourage all Manitobans to get, if they haven't, get their first dose as soon as possible, and if they have, get their second dose as soon as possible as well. To date, we're over 946,000 vaccinations that have been administered in Manitoba. That's a little more than 2/3 of eligible Manitobans who have received at least 1 dose of vaccine. And that is a significant accomplishment, and I thank Manitobans for making that happen. We've got a dedicated staff and volunteers that I'll thank again for the monumental challenge they've accepted of providing those life-saving vaccines as quickly and safely as possible, but it's you as Manitobans that make the decision to avail yourself of that vaccine. So thank you for doing that. If you've rolled up your sleeve already, thank you for doing your part. It's time for all of us to get on Team Manitoba, work together, get this vaccination campaign in full gear so we can protect each other, protect our healthcare system, protect our economy and our communities as well, our way of life. Manitobans are community-minded people, We lead the country. We've led the country for decades in volunteerism and supporting worthy causes. And this is the most worthy cause, perhaps, that any of us will have the chance to support in our lifetimes. We need your support. We need Manitobans to roll up their sleeves and get vaccinated. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from the Canadian Press, Steve.
Morning, Premier.
Morning, Steve.
These vaccination cards, is the government also considering using them for entrance to provincial-owned facilities, whether that be a museum or a casino or some other provincially controlled environment?
There's a lot of possibilities here, Steve. I think what we all hope is that this is a temporary measure made necessary by the absence of the sufficient numbers of people who have got their vaccines yet, and the sooner we can get to that level, the better for everyone. But I'll have more to say on the reopening strategy later in the week, and that may be relevant to some of what you were addressing just now.
Okay. And I'd like your reaction to concerns raised by emergency room doctors at 3 Winnipeg hospitals earlier this week. They've raised concerns about nurse staffing levels, the risk of burnout, the mandatory overtime. And given that we may or may not be at the peak of the demand on the healthcare system for this third wave, what is the government doing to address the concerns raised in that letter and to address the nursing situation without having to dip so much into all other areas of healthcare?
Yeah, I think I'll let the acting health minister refer specifically to the points the doctors raised in their letter. And I also encourage I think that an additional level of stress for some of the nurses most certainly is the labor negotiation that's underway right now, which, as you know, I won't do through the media. I'll simply say that I encourage everyone to get to the table and work that out so we can get that additional level of stress away from our frontline nurses. And again, I say thank you sincerely to all of our healthcare workers for the great job that they've been doing throughout this pandemic, and frankly that they always do. We have a great health system in our province, and we're fortunate to have great people that work in it.
From CTV Winnipeg, Jeff.
Well, hi, Mr. Premier. Just
Hi,
kind of following up on Steve's first question. Hi. The survey lists a number of priorities, that the government might look at for people with, both vaccinations. And you've got a couple of them in your announcement today, but what about things like Gold Eyes and Blue Bomber games? Are you looking at that seriously, where that, because I'm thinking of summer, where that is something the government's really considering, allowing people into those events, getting those events going, having fans in the stands, if you've got, your immunization card?
Yeah, it's a good question, Jeff, because of course we miss those group gatherings. And Dr. Roussin and the health team are always mindful of the possibility of an event being, COVID friendly, we'll put it that way. And clearly, the sooner we can get, this card in the hands of as many Manitobans as possible, the better, because this is the way that they'll be able to demonstrate that they've done that double vax situation. The ramifications of that could be many. Again, we all hope that that's a temporary measure. And simple point again, though, the sooner that we can get as many people as possible double vaccinated, sooner we can get some of these things back into our lives, like group events, which you just referenced.
Thank you. And Dr. Roussin had suggested yesterday that the province is looking at tweaking rules for outdoor gatherings. What are you looking at? Are you looking at maybe having, going back, maybe a designated to people again, people on private property or in public property? Could you maybe give us an idea of what you're looking at?
Well, I can do better than that. I can assure you that Dr. Roussin will be floating those proposals tomorrow. And I will repeat, however, that we remain the hotspot in terms of our number for positive test outcomes for COVID tests. And that means that an abundance of caution has to be used, because what we do not want to do is worsen what is already a very serious situation. It's getting somewhat better, there's no doubt about that, but it needs to get better yet for us to sustain our recovery. And that's, I think, what most Manitobans want to see, is a sustained recovery. We don't want to see a big reopening and then we're yo-yoing back to taking restrictions back again in July or August. That's the last thing I think most Manitobans want to see.
From City News, Mike.
Good morning, Mr. Premier.
Morning.
First question, is getting a physical copy of your immunization identification over a digital, is it a preference thing, or would there be a specific reason to have either or both?
Well, I think some people depend on the paper copies, and we want to make sure they're still available, the plastic copies, I guess, to be more accurate, but the digital will suffice. And as far as applications, I know that I've already had a couple of questions referencing potential applications for this. I think it is premature at this stage. We are going to talk more about our reopening strategies later in the week. So there'll be potential for additional benefits to accrue, I suppose, outside of the ones I've mentioned, but I don't want to extrapolate beyond what I've said so far today.
Thanks for that. And my follow-up, this might have been answered already, and forgive me if it has, but at what point in our vaccination uptake do we eventually get rid of these immunization cards? Do we have to hit near 100% threshold province-wide?
Yeah, no, it's a good question, and I think that there's no doubt that the reopening strategy will rely on certain benchmark levels, and that's what we'll be talking about later in the week, sharing that with Manitobans. Those benchmark levels, like, for example, positivity test results and percentages of people vaccinated, have varied since the speculation began about what would constitute so-called herd immunity. And I think it's important to realize and remember that this has been an evolving, unprecedented scenario. So creating an opening strategy is one thing. Making sure that it can be adaptable and adapted to, for example, the presence of new variants that are more vicious than the older ones were potentially is a real necessity in any reopening strategy. That being said, I think all of us want to see some hope in the window. We want to see some possibilities of what could happen, and I think most Manitobans recognize it's going to be a what could happen if scenario as much as anything. But I think it's important to lay that out, and this week we plan to do that.
From CHVN, Taylor.
Hi, good morning. Are there any concerns with these cards about duplication of the physical cards or at the online site?
No, I've been assured that the privacy issues, the protections that are in this card are going to be very real for people. And remember, this is just going to contain your vaccination, yes or no, once and twice. That's the evidence that's on there, so not your other public health details. But as far as duplication, it's not my area of expertise. I can only tell you there's been assurance given that this is going to be assured.
And will these cards do anything for people who are outside of Manitoba? Let's say somewhere like Ontario allows gatherings if you're vaccinated twice. Will these cards be able to prove in another province of these vaccinations?
Good question, Taylor, and that's one the premiers have talked a little bit generally about this. Of course, until recent days, our neighbors were up to their armpits and alligators like we are now, and so more talk about what was going on in their own jurisdictions was probably the focus. But on the premiers' calls, we have alluded to this, and I think this is an area that we need to look at, interjurisdictional cooperative strategies around how we can reopen because, as I've said today, domestic travel is back on for double vaccinated people without the 2-week isolation. that's a big deal. That's a really good opportunity for Manitobans to travel. But again, each province will have its own requirements. Up until now, we've had some of the most stringent. Hopefully we don't have to do that for a lot longer, but right now that's the necessary approach we've taken. But nothing to say that there won't be a fourth wave at some point and other restrictions may come in. And so the more understanding of what the requirements are across the country, the better. So it's a good point, and further discussion I know will be had on that and on other issues like international travel, for example, where we've already raised that in discussions with the premiers and prime minister.
From the Winnipeg Free Press, Danielle.
Good morning, Premier. Manitoba has yet to release a recovery plan tied to vaccination rates, but we do see that other Canadian provinces, including Alberta, Ontario, Quebec, are rolling back restrictions this week, and they have immunization rates that are equal to Manitoba. You say that a reopening strategy is coming this week, but how soon will Manitobans see their choice to be immunized actually reflected in public health orders overall?
Well, that's a fair point, Danielle. I think what's key is the interactivity between the consequences, the real consequences of COVID and vaccine rates. Both have to be considered, I think. It's clear in any reopening strategy. They're all hypothetical. I've seen other jurisdictions delay theirs in part. As recently as yesterday, New Brunswick pulled back on theirs based on the rationale there weren't high enough vaccination rates. Another jurisdiction could hypothetically pull theirs back on the basis that there were higher COVID numbers and that positivity numbers were going up. This is an unprecedented situation, as you well know, and it's one in which it's important, I think, that we get out there with what hypothetically could happen, tied to not only vaccination rates, but also tied to the consequences of remembering that COVID is real and that it has impacts on our ICUs, for example, and on our hospitalization system. So again, any reopening plan is going to be a hypothetical exercise in hopefully building real hope, not imaginary hope. And I think it highlights the importance of our decisions as individuals when it's tied to vaccination rates, most certainly, because it is an encouragement then for people to pursue that avenue to get their lives back and help us all protect each other.
Thanks. And with respect to the immunization card, so vaccine task force officials have said that the first dose is already highly protective and that the second dose is a booster to strengthen and lengthen that protection. It will be at least another 8 weeks until Manitobans are fully vaccinated. Moving forward, do you want to see different restrictions for people who are partially immunized as well, at least in the interim?
Well, what I would hope to see, and I guess, I think this is what all of us would like to see, is the old days back and COVID defeated. That, I suppose, is the ultimate win for all of us, because then this becomes unnecessary. What we're talking about today with vaccine cards, providing evidence of vaccines isn't going to be necessary. But in the real world we live in, we're going to see gradual uptake on vaccines. The faster that we can get our folks to do that, the better for our economy, for our social life, for our healthcare system. That's pretty clear. And so, it's that we have to focus on. Following the public health orders, which are necessary for us to protect one another, and at the same time recognizing the awful nature of the variants. Like, we're hearing reports about the Indian variant not being very as well fought against, if I can put it that way, by the first shot. All the more reason that we need to get to that second shot situation, which I understand really increases and enhances the protections people can get against that variant. So another reason why we need to proceed enthusiastically to get that vaccine in arms.
From Global News, Merrick.
Good morning, Mr. Premier. What's the most prevalent age group where you guys are still noticing vaccine uptake as an issue right now, and how do you continue to reach those Manitobans that remain hesitant, specifically in that age group?
Yeah, I don't have, Merrick, I'm sorry, I don't have the numbers right in front of me. The VAX team would be able to get you those, though. But I've got some hopes for the community outreach that we're doing. I understand the initial response has been really good, and we'll get you an update on that as well fairly soon. But those community groups are the ones that are in direct contact, whether it's a sports team or it's a community club. They're in direct contact and closer to the folks that we need to persuade. And very likely they are more influential in terms of persuading, because they're in that circle of friendship and trust that will persuade folks, I think, to take up the opportunity to get vaccinated. So Vax team can give you the specifics. We'll give you an update as soon as we can on the community outreach that I announced last week. But it's a multi-tiered strategy that we're using to try to motivate and encourage folks to do, to make the decision to get a vaccine in arm and to do it again the second time. And we'll continue at it because we think it's worthwhile to get our lives back.
And my follow-up is just, is there plans as of right now to enforce the travel measures for that fully vaccinated Manitobans? And if so, how?
Well, there's been enforcement. I just got a quick overview on this week's numbers. It continues to slight decline over last week, but there weren't as many protests organized last week, so the numbers were down. But tickets continue to be given out, fines to be levied. The deterrents are there; they're real. But the benefit, obviously, of getting that second vaccine is to be able to travel domestically. And then to return without having to isolate for 2 weeks. And I know that all of us who would have family or friends in another part of the country will really appreciate that opportunity. And I know also a lot of small business people. I've got very interesting input from the Chambers of Commerce, from the Manitoba Business Council, on members of their organizations that have been very concerned about losing business to competitors who don't have the same level of restrictions that Manitoba has had and that we have continued for some time. So now they're clearly, if they haven't already been motivated to get vaccinated, they have a good additional reason to do that if they're in a business situation where they want to be able to travel to another area of the country without having to isolate upon their return.
From the Brandon Sun, Colin.
Good morning. What consideration has been given to allowing people from other provinces who can prove that they've received both their vaccine doses, allowing them to skip the quarantine process if they have that proof?
Yeah, that's a topic that's under discussion right now, and one that we're going to have to weigh very heavily, because just as I referenced small business as an example just now, just as it's a benefit to a small business person to be able to travel to see a client in Ontario or New Brunswick or BC and not have to isolate for 2 weeks upon return, so too is it a benefit for our small businesses to be able to host a training session with someone coming in from another part of the country where they don't have to isolate for 2 weeks. Quid pro quo would say, common sense would say, if other jurisdictions are moving ahead with some type of evidentiary measure like we are, that might be something that we could reciprocate with them to allow for people to come in. But that hasn't been finalized yet. I wouldn't want it reported. I'd just keep it between you and me. But it is something that would seem to be logical and would allow us, as Manitoba is a free trading province, would allow us to resume at least initially some of the economic and social ties that we have with other parts of our country more readily. And that would be beneficial, I think, provided that the safety concerns are first addressed.
For my follow-up question, I was wondering, this might not be a common scenario, but if someone is currently in quarantine returning to Manitoba and have received both vaccine doses and apply for their digital or physical card, does that mean that they can cut their quarantine short? Or does everyone who was quarantining before today still have to go through that full process?
You know, Colin, you've asked a really good question. The evidence, the data processing time, I'm not sure the turnaround time, so I best not speculate. But it would seem common sense that if they've satisfied the requirements of the double vaccine already, that as soon as possible we would be able to get them evidence of that, and therefore their isolation would end. But we'll get you an answer for that rather than me speculating. How's that?
From CJOB, Skylar.
Hi, Premier Pallister. Just a question about, families who may get to a point where mom and dad have both shots. They're able to travel, but they might have a couple of kids under the age of 12 who obviously aren't eligible for a shot at all. What considerations will be given to, families like that or younger children? Are they able to travel freely as well in the meantime?
Kids under 12 are exempt if the parents are vaxxed. So if you're looking to take a couple of noisy little kids on a car trip, you can come back home and you won't have to isolate. But if your kids behave like my brother and I did when we were under 12, you probably don't want to go for a car trip with them.
Thanks for that. I'm still struggling to kind of wrap my head around how this will be properly enforced. If, say, someone does go on a car trip, if they have one shot or they don't have any shots at all and they, drive over to Saskatchewan or Ontario, they come back and, they go to work the following Monday or any, something like that. If there's, if they don't get infected with COVID and they don't have to come into contact with a public health official in the following 14 days, how exactly will this benefit the folks that are fully vaccinated?
Well, as Dr. Atwell put it, I thought rather nicely last Friday. He said, you're supposed to abide by the spirit of these rules, and it's an honor system, and I believe Manitobans are trustworthy in the vast majority, so they'll honor the rules. If you have double vax, then you don't need to self-isolate, and if you don't have double vax plus 2 weeks, then you do. That's the rules, and there have been fines levied, and sadly we'll have to continue to do that, I guess, to enforce these rules. But they're there to protect us all and to protect you too.
From the Winnipeg Sun, Josh.
Good morning, Premier. Josh Aldridge, Winnipeg Sun. Looking at these the vaccination passports, there's a lot of debate over whether they're actually constitutional or not, or another infringement on rights, particularly because not everybody can actually physically get a vaccine, especially when it comes to different health issues. So people who have health issues cannot get a vaccine. Will they still not be able to travel within Canada, or they just have to wait out? What kind of care has been taken into looking into the constitutional issues that revolve around these vaccine cards?
So we have announced today the lifting of the requirement for self-isolation on return to Manitoba of domestic travel by folks who have been double vaccinated plus 2 weeks. That 2 weeks, of course, is the period our health leaders tell us it's necessary for the vaccines to take. But they're not perfect. And so I would remind Manitobans to be careful, even as they are traveling, to be careful, as you've referenced, to follow the distancing rules, to wear masks when appropriate, to avoid crowded spaces, to wash your hands regularly, to do all those things. Don't let your guard down, because COVID is not going to let its guard down. And so the spirit of the rule here is to try to give people some semblance of their lives back, and to tie it to the best measure we can find that protects people, and that is getting a needle in your arm not once but twice. And so it's not going to be perfect. We hope it's not a long-term necessity, but it is a start to getting our lives back, and it is a benefit to those who choose to get double vaccinated.
You brought up the health orders a couple of times, or the health enforcement rather, health order enforcement a couple of times. Regarding the update today, one particular part. Enforcement officials note that they have also sworn information under the legislation to a business for repeated offenses where the courts will determine the fine amount. Other documents within the update say they can be fined up to $1 million and pointed to the Church of God Restoration. What precipitated this procedure? I think this is the first time it's happened in Manitoba where we've gone this route during the pandemic. Was there a certain event that happened, or is this just an accumulation of events that have occurred with that particular church?
Josh, I'll ask the justice officials to release what information they can to you and any other media that are interested, rather than speak about an individual case. I think that's probably more appropriate. I hope you'll accept that, and we'll get any information from the justice folks for you that we can.
Thank you.
From CBC Radio Canada, Chloe.
Bonjour, Monsieur le Premier Ministre. You said the secure immunization card is a temporary measure. Could this card possibly be required by employers, for example?
There are many things, Chloe, that are beaucoup de choses. Hein? C'est possible. It's sont possibles. Many things that could happen in the next while as a consequence of people getting a vaccine or not. What we've announced today is some additional benefits that will accrue to those who do, clearly as a way to reward and to offer incentive to some degree to some folks, we hope, who might otherwise consider delaying getting a vaccine so that they move on that. As far as the issues around human rights that were raised earlier and that you've referenced now, I think it would be premature to speculate on requirements in the workplace or for the use of certain facilities at this juncture. I think the goal we all have is to get back together, all of us safe and sound, and to move to a reopening where all of us have these freedoms and benefits that we always took for granted too much, probably, in the past.
Merci beaucoup. And are you thinking of loosening more restrictions specifically for those vaccinated in the coming days or weeks? Is this card the first step toward more similar loosening for those vaccinated?
Well, I'm cognizant, Josh just acknowledged folks who can't, for medical reasons, get a vaccination. I'm cognizant that we don't want to take away rights and freedoms from people. At the same time, COVID is doing that for us. And so the sooner we can get as many as possible vaccinated in Manitoba, the better off we're all going to be. And here in Manitoba, we are currently the COVID hotspot. Look, for 2/3 of this pandemic, we've been the cold spot, and now we're the hot spot. But let's use this reality, the sad reality of the demand we're putting on our healthcare system right now, of the lives that are being impacted by COVID and by its variants. Let's use this as inspiration. Let's use it as motivation. Let's use it as a way to persuade those who might delay, defer, postpone. It took decades for the Salk vaccine to help eliminate polio. It took decades for smallpox to be eradicated because people took their time believing a vaccine could help. But a vaccine can help us to get our lives back if we choose to get it. So I just encourage everyone to do that. I think this is the way out, and the way, if you want to say it's the way back to a time when we could see friends, when we could visit with our family and loved ones, with travel not being taken as a privilege that only could be given to some. We want to get back to those times, right? So we're all in this together, and I hope we can stay together. I don't want this card to be used as a divisive thing. I want it to be seen for what it is. It's an additional benefit to folks who choose to get a second vaccine, not anything but that.
Our final reporter this morning, Mr. Premier, from CBC Manitoba, Bart.
Hi, Mr. Premier. What plans are in place, or what rights right now do exist for people in other provinces you visit who can demonstrate proof of 2 vaccinations?
Sorry, Bart, I'm going to try to answer what I thought you said, but I'm not 100% sure I got it all there. I think you're asking about what if somebody has 2 vaccinations in another province comes to Manitoba. Is that correct?
That is correct.
Yeah, that's in discussion phase, and I think that, as I said earlier, I think common sense should say that we would be able to extend some benefits to others who do the same thing we're extending to Manitobans here. But it isn't finalized, so I'm not announcing it today, so it's just a secret between you and I and the other people on this call.
Forgive me. You did answer that. I couldn't actually make out that part of the broadcast. Forgive me. The other question is, like right now, and I don't like to do this, but socials are sort of lighting up. Double vaccinated people want to know why they can't use these cards right now to visit their friends. What would you say to elderly Manitobans, many of whom have been especially isolated, who make up the majority of our double vaccinated, who can't visit each other right now? What would you say to them?
I'd say I'm with you. I'd like to be able to visit my friends too, and I'm not able to. I'm getting my second vax in a few days, and I hope that I'll be able to do that a couple of weeks thereafter. But there'll be more to say on reopening rules and so on later in the week, and so stay tuned. I like you, Bartley, I like my alone time, and I'm not afraid to have solitude, but I also like to have time with friends, and I think most Manitobans do too. I think this is probably right up there with travel and having a chance to visit with your friends and family, that those are very much the highest ranking things that people miss right now. So totally understand it, and we'll have more to say on that later in the week. I want to say thanks to everybody. Stay safe. I want to say thanks to Winnipeg Jets for their efforts, and go Canada. I have now become a reluctant Habs fan. I will be putting out a picture of myself wearing a Habs jersey. I want no confusion on this issue. I remain a Winnipeg Jets fan first and foremost, but it was the result of a wager. I don't normally gamble, but in this case I gambled with Premier Legault, and he won. So I'll be tweeting that picture out later on, and I am cheering for the Canadian team to come through and win the Cup this year. So thanks, Jets. Thanks, Paul Maurice. Thanks for all your efforts.